Sepsis syndrome, often referred to simply as sepsis, is a potentially life threatening condition caused by the body's extreme response to an infection. It occurs when the immune system overreacts to an infection, leading to widespread inflammation, tissue damage, organ dysfunction, and, if untreated, death. Sepsis is a medical emergency that requires prompt diagnosis and treatment. Etiology causes. Sepsis can be triggered by various types of infections, including 1. Bacterial infections, most common cause. 2. Viral infections, such as influenza or COVID-19. 3. Fungal infections, especially in immunocompromised individuals. 4. Parasitic infections, although less common. Infections that often lead to sepsis include pneumonia, urinary tract infections, UTIs, intra-abdominal infections, e.g. appendicitis, peritonitis, skin infections, e.g. cellulitis, bloodstream infections, bacteremia. Pathophysiology. 1. Initial infection. An infection triggers the immune system to release pro-inflammatory mediators to combat the pathogens. 2. Systemic inflammation. In sepsis, the inflammatory response becomes exaggerated and systemic, affecting organs distant from the infection site. 3. Endothelial dysfunction and coagulopathy. Damage to the endothelium leads to increased vascular permeability and leakage. Microvascular clotting can cause disseminated intravascular coagulation, leading to further tissue hypoxia. 4. Immunosuppression. Later stages may involve immune system dysfunction, increasing susceptibility to secondary infections. 5. Organ dysfunction. Hypoperfusion and tissue damage result in progressive organ failure. Signs and symptoms. 1. General symptoms: fever, chills, or hypothermia, low body temperature, rapid breathing, tachypnea, and shortness of breath, rapid heart rate, tachycardia, altered mental state, confusion, delirium, or lethargy, extreme pain or discomfort. 2. Severe sepsis involves organ dysfunction, characterized by low urine output, oliguria, jaundice indicating liver dysfunction, severe hypotension, cyanosis, bluish skin, lips or nails. Diagnosis. Sepsis is diagnosed based on clinical criteria and laboratory findings. 1. Clinical tools. SIRS criteria, systemic inflammatory response syndrome, includes abnormal temperature, heart rate, respiratory rate, and white blood cell count. Q-SOFA score, quick sequential organ failure assessment, identifies patients at high risk of sepsis based on mental status, respiratory rate, and blood pressure. 2. Laboratory tests. Blood cultures to identify causative pathogens. Lactate levels elevated in tissue hypoxia. Complete blood count, CBC, with differential. Coagulation profile and D-dimer to detect DIC. Organ function tests, renal function, liver enzymes, arterial blood gases. Stages of sepsis. 1. Sepsis, evidence of infection and systemic inflammatory response. 2. Severe sepsis, sepsis with organ dysfunction or hypoperfusion. 3. Septic shock, sepsis with persistent hypotension, requiring vasopressors and elevated lactate levels. Management. Sepsis treatment focuses on controlling the infection and supporting failing organs. 1. Immediate actions. Recognize and treat sepsis as a medical emergency. Administer broad-spectrum antibiotics within the first hour. Perform source control, e.g. drainage of abscesses. 2. Fluid resuscitation. Intravenous fluids, e.g. crystalloids, to restore perfusion. 3. Vasoactive medications, vasopressors, e.g. norepinephrine, for persistent hypotension. 4. Supportive care, mechanical ventilation for respiratory failure, renal replacement therapy for acute kidney injury, nutritional support. 5. Monitoring, close monitoring of vital signs, organ function, and lactate levels. Complications. 1. Septic shock, persistent hypotension despite adequate fluid resuscitation. 2. Multi-organ dysfunction syndrome, progressive failure of multiple organ systems. 3. Death. Sepsis is a leading cause of mortality worldwide. Prevention. Timely vaccination, e.g. against influenza, pneumococcus. Prompt treatment of infections. Adherence to hygiene practices, including hand washing. Proper care of invasive devices, e.g. catheters, central lines. Prognosis. The outcome depends on the severity, the speed of diagnosis and treatment, and the patient's underlying health. Mortality rates range from 15 to 30% for sepsis and 40 to 60% for septic shock. Sepsis requires coordinated care, typically in an intensive care unit, ICU, emphasizing early recognition and timely interventions to improve outcomes.